Good morning. I want to welcome you to our press briefing with updates on COVID-19. As of this morning, we've lost some 180 citizens in our community. Please join me in a moment of silence for the lives we've lost.
Thank you, Chief. I just want to talk briefly about the mask ordinance that has been enacted here in the city of Albany. First, let me say we've known for months that the most effective way to curb the spread of the virus is by wearing face coverings, a mask. We did not have an ordinance here in the city of Albany because the governor, from the time he enacted one of his first executive orders, basically prohibited local governments from taking any action which was any more or less restrictive than those executive orders. In those executive orders, it required people to exercise the hygiene practices we're all familiar with, to maintain social distance, but it only encouraged citizens to wear masks. So what the city of Albany has done, now that the most recent executive order allowed cities and counties where the rate of infection exceeds 100 persons per every 100,000 population to implement such an order. We have done so. Now, I want to talk briefly, and I'm not going to continue this acrimonious discussion. Some people are just unnecessarily discourteous and even unreasonable in what they say. But from my perspective, there is no issue of constitutional rights. There's no infringement on personal liberties. And these two things are, while similar, are not synonymous. You know, we have requirements in society. No one is being denied a right to speak out, to worship, to assemble, or to even protest this mask ordinance. If you want to do so, that's your right. But I would also ask you to abide by the ordinance. We hear people say, this is my right. But what we know is that wearing a mask protects others as much or more than it protects yourself. And that is because what we have heard from this lectern for months is that the virus can be spread by someone who does not know he or she is infected. Some research tells us that people are most contagious at a time when they are asymptomatic. Now, we hear this discussion that only 6% of the people who died of COVID didn't have any underlying condition. My father is 86, 87 years old. He's been in his room in an assisted living facility for months. He is clearly within the category of those who have been called the medically fragile or the most vulnerable. What I would suggest is that we basically recalibrate ourselves and think, if I was 80 years old, if I had these underlying medical conditions, I get calls, emails from elderly people who are upset that they have gone in public and the number of people who are not wearing masks, who are not following the precautions you've heard time and time again. Now, this is an issue, and let me say this before I talk briefly about the mask and I'll give up the lectern. We say, why now? I've explained it. Why not 4 months ago? Well, originally, there was some confusion as to the CDC was saying you don't wear a mask. And that apparently was because there was concern about the supply of masks. But then we were prohibited from doing so until the governor's most recent order. How do you wear a mask? Dr. Blacks has explained that. Others have explained it. You need to make sure that the mask is secure to your face, over your nose, and over your mouth. Why is that? Simple enough. That is where the aerosols and the respiratory droplets are going to be projected from. But also there are certain procedures. We don't need to wear masks day in and day out. The cloth masks need to be laundered. Other masks need to be discarded. It's not difficult. We have some frequently asked questions on the city website, and I would encourage you to consult that for guidance on how to wear a mask. Then the issue has come up, what kind of mask? It's a face covering, people. It's simple enough. We've heard it before. If you wear a cloth mask with two sides, that was double the protection that's provided. If you have one of these synthetic masks, which have a layer in the middle, that's 3 layers, those are probably the most effective. But please, whatever you do, wear a mask, a face covering when you're in public. If you don't have a mask, call the city. We have an ample supply. We have tens of thousands of masks that are available for our citizens. Now, let me just go through this briefly because I think there's a lot of confusion. There's published about businesses that are going to opt out, which businesses do have the right to opt out. But for months, businesses have the right to require people to wear face coverings as well. But I've seen restaurants opting out. I've seen churches opting out. The fact of the matter is people who are eating and drinking in restaurants don't have to wear masks. They've been excluded forever. Houses of worship are excluded. This, I think, is an indication of how this issue has been unfortunately politicized in recent months. People that have medical reasons, have asthma, please just have some type of statement from a physician. Otherwise, if you get a citation, you go to court, and you can establish to the judge that you have a reason for not wearing that mask, you won't be fined. It's a $25 fine for the first offense, a $50 fine for the second offense. Nobody is going to be jailed for failing to comply. What we're going to ask, the Albany Police Department is going to ask, is that you just move on. This is something that is, in my opinion, a very, very small inconvenience to protect our community. Some, if you consider it a sacrifice, well, we still are in the midst of a pandemic. And if that is the only thing that's being asked of you, I would certainly encourage our citizens to really reevaluate their objections, those who have objections. We recommend that if somebody's not wearing a mask, that you not confront them about doing so. What the proper procedure would be is just, if you're in a business that requires it, to notify the manager or the owner of the business if it's required in that business. But if you see someone out in public, what you can do is contact the Albany Police Department. And again, we're not going to arrest anybody. We just want to educate the public. We want people to cooperate. We want to work together. We want to eliminate this virus from our community. And here we have one more tool to fight the virus. And I would respectfully request that everyone cooperate. Thank you.
Thank you, Mr. Mayor. Now we will hear from Dougherty County Commission Chair Christopher Cohelas. Mr. Chair.
Thank you, Chief. Thank you, Mayor. Morning, everyone. Today I come before you to talk about what we have been talking about for some time. As you may recall, the county, the city, and the school system have entered into a very unique partnership with Augusta University, and this is going to bring some significant value to our community by way of information and in assessing where we have been and where we're going with respect to the virus. We've all had to go through this intense learning curve where we're learning new things about this disease and this virus, about its impact, and there are so many other things that we still have to learn. But one of the things that we know that we have that is a tool is antibody testing. And through a unique partnership between the county, the city, and the school system, we have pooled our dollars. We've pooled the dollars that are the public's dollars, your tax dollars, in order to better and more efficiently purchase antibody testing for our community. And the reason why we're doing that, is so that we can obtain a statistical sample that has statistical value for us in learning about a cross-section of the community that represents our progress, represents how many people have overcome the virus, how many people have the antibody. And I want to explain for a second what antibody testing is. This testing that happens will literally, you'll go in, you'll have blood drawn. That blood will be tested by lab techs and scientists with Augusta University, and they will look to see if you have the antibody for COVID-19. Why is that important? Because we know many people in this community have had the virus or been exposed to the virus in some form, but have never experienced the first symptom. And so this is a way for us to determine how many people have the antibody. And the antibody, having that antibody is suggestive that you have overcome the virus and that you have some degree of immunity. Does it mean you're absolutely immune forever? It does not mean that. We are still learning information every single day, month, and week that goes by from the CDC and from the scientific and medical community about what that means. But as I mentioned, I think about 2 or 3 press conferences ago, one of the things that I was very encouraged to learn was that the CDC had stated that there was no credible evidence that any person who had tested positive for COVID-19 and gotten over it, that they had recontracted the virus within a 6-month period. That is, in and of itself, highly suggestive of some degree of immunity. So why is this information important for our community? Well, it helps us determine how many people in our community, or a percentage of people in our community, that have overcome the virus. Well, why is that important? Well, it helps us determine and plot our progress as a community as we move forward in making future decisions about what types of behavior we encourage, what types of behavior we discourage, what percentage of people have overcome the virus? Where do we fit in the scheme of the world in terms of our progress? We know that we have made tremendous progress through tremendous concerted efforts from the citizens and government and businesses and the business community and all of our partners to overcome being number 3 in the world in terms of per capita infection to come to where we're at today. And our position today is very reasonable. We're going through the second spike, but our position is nowhere near where we were 4 months ago. And it's because we've taken so many steps, and we've also really worked hard to get high-level data that we've been able to utilize on the ground to make decisions that benefit our citizens. And I really want to encourage everyone to take part in the antibody testing. And I want to give some information here today because we're about to launch the scheduling of our COVID-19 antibody testing with Augusta University, and we're going to be opening up lines on Wednesday to our community. I want to encourage everyone to call and pre-register at 706-721-1414. 4905. Again, that number is 706-721-4905. Space is limited and appointments are required. This is very important. There's a limited number of spots that we have purchased in order to be able to gain access to this data. But I do encourage you to please call, pre-register. They will sort through everyone. They're going to make sure that they get a geographical and representative sample of our community so that we can get the best data possible to plot our progress. And I think we're going to be the second community in the state of Georgia to actually deploy this testing. The other was actually in Augusta, if I remember correctly. And we were, as was reported to us about a month ago, we were the most heavily tested site, this region, in the entire state of Georgia. So these are resources that are very unique and special to us. They are resources that many other communities have not gained access to. There are many resources that other communities and their leaders don't have the ability to access so that they can make decisions or encourage certain behaviors like we are able to. And I'm very thankful for us being able to access this on a moving forward basis. Regarding the debate concerning masks and the mask ordinance, here's what my position is. I believe that masks work. I think it is important to encourage people to voluntarily utilize masks. I think it's important for us to continue to encourage our citizens to utilize masks. I'm not interested in a political debate about it. I'm interested in a human discussion. I think it's important for us to wear masks in our interactions in public when we can't be more than 6 feet away from people. I think that we know that the research shows that it is helpful. I understand the arguments on both sides. The county has not taken a position with respect to a mandatory ordinance, and frankly, it's my position that I think that we're probably better off in the county encouraging businesses and encouraging people to voluntarily either require masks at their businesses or to voluntarily wear them. That's just my position with respect to the county, and I think that we have done very well, and I'm still very thankful for our citizens and our business community. I'm very thankful to our Chamber of Commerce for creating a program that literally incentivizes businesses to voluntarily require masks on the premises. I think that that has been a good move for the community, and I'm thankful for those people that continue to wear masks, continue to exercise best practices, and frankly, that is how we have flattened the curve so well in this community, because we had trust, because our citizens listened to the messages that we were delivering and that the healthcare professionals were delivering and the latest information that we were able to gain. And because we have done that and we've voluntarily done that, we have been able to overcome tremendous odds. And I'll say this, as I've said time and time and time again, this is a marathon, it is not a sprint. It is a battle of discipline and diligence. It is one where we have to continue to exercise our best practices and rethink how we live our lives. And I understand completely the inconvenience that a lot of this has placed on so many people. And I think one day we're going to look back at all of the good decisions and the bad decisions that were made in the midst of this pandemic. And we're also going to have to continue to evaluate the secondary damage that comes from a pandemic and trying to respond to it, because we have so many people that are suffering from mental health issues, people that are not getting diagnoses for conditions like cancer or cardiopulmonary disease or what have you. We have people that aren't accessing and connecting to the resources that they need, and we have to continue to find ways to be able to go about our everyday lives, because having people pass away from diseases that are completely preventable or treatable because they're locked away in fear at their home is unacceptable. And one of the most effective ways that we have to be able to battle those problems, making sure people are getting mental health treatment, making sure that people are going in and getting cancer checkups, making sure that people are getting their medicines, making sure that people are having regular visits with their doctors. One of the most effective tools we have are masks. And I would continue to ask our citizens to voluntarily wear those masks, to be mindful of the impact of not wearing a mask when you can't be more than 6 feet away from someone. I want our businesses to continue to think of ways to be good stewards. And I want to thank our citizens and our businesses for 99% of y'all have done an outstanding job. And if you view our progress, our conduct, and frankly, our excellence in dealing with the worst of the worst, I would give us an A+. Thank you.
Thank you, Mr. Chairman, for your comments today. Now we'll hear from our representative from Phoebe Putney Memorial Hospital. We're pleased to have with us today the CEO of Phoebe Putney Health System, Mr. Scott Steiner.
Thank you, Chief. If I could just start off just remembering that today is Patriot Day, the 19th anniversary of the tragic occurrences in New York City, Washington, D.C., and in the fields of Pennsylvania, where we lost thousands of Americans, and we've had young men and women who have been fighting since then to continue to fight for our freedoms. So we recognize those sacrifices today. So our hospitalizations, here's our current dashboard. We've got good news to report. That this week we have 35 in Albany that are hospitalized with the primary diagnosis of COVID-19. 9 in Americus. This is down from 46 in Albany last week, so a reduction of 11. And 1 less than just a week ago in Americus. Those are absolutely great signs. We're very hopeful. Last time we were at 44 patients between the two hospitals or less was July 3rd. So we have made significant progress as a community. And just to echo the comments of Chairman Cohilas and the mayor, we've got to do this as a community, and we have, but there is still work to do. Our outpatient testing positivity rate, we also look at that. Again, this is just for Phoebe Putney, not necessarily the entire community. Back in March, 46% of everybody we tested was positive for COVID-19, 27% in April, 8% in May, 6% in June, that downward trend. We know in July it jumped back up to 12%, came down to 11% in August, and so far in September, 6%. You can't help but look at that correlation between outpatient positivity rates and those that are in the hospital. Those are directly correlated. You know, this week I had the opportunity on Wednesday to visit Phoebe North, where we have 10 patients in one of the ICUs there fighting for their life, all COVID positive patients. All 10 of them are on ventilators, and I was watching through the glass door the nurse care for one of the gentlemen that had come in about 30 days before. So in early August he was fine. He contracted disease and he was fighting for his life. I counted 12 IVs that he had, 12 bags that were hanging, delivering medication, delivering fluids. It's the most I had ever seen. We had 3 different pumps that were administering those medications. He was also on a ventilator because his lungs could no longer help breathe, and he was being dialyzed. His blood pressure, his heart rate was running between 35 and 40. The man was very sick. His prognosis was not well, though just 45 days ago he didn't know he would be in that situation. That's not meant to instill a state of fear. That's just reality that sometimes people don't always see, and that could be your father, it could be our mother, aunts, uncles, children, it could be us. And so it's just a reminder that this is not over. It's not time to let our guard down. We have a number of items coming up that are coming up that are going to cause concern. Schools restarting. Sports are starting. Tailgating is starting. We've got Labor Day. People are going to be moving back indoors with the weather changes. We have to remain vigilant. We have to remain vigilant as we think about how this virus spreads, because we don't want to see anyone in our community in the hospital. The last thing we want. Just a reminder, some of those tips: wear a mask. The science proves it. I know there's people out there that maybe don't believe the science related to that, but it's the same science that speaks to the efficacy of washing your hands and how important that is. Get your flu shot. Flu shots are now available for the normal influenza season. They're available. Contact your doctor. Get your flu shot. That will be vitally important. And wash your hands often. Thank you. God bless you. And on Patriot Today, God bless America.
Thank you, Mr. Steiner, for your comments today. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz.
Thank you and good morning. There are different ways that we measure or gauge the extent of COVID virus activity in a community. Some of those methods have already been mentioned this morning. Mr. Steiner just reported to us that when you consider the COVID-19 tests that have been done at Phoebe, as of late, the rate of positive tests is around 6%. And that is very similar for Dougherty County as a whole over the past 14 days. When you consider all of the tests that have been performed in Dougherty County, the positive rate is 5.6. Which means that more than 94% of people who are tested are negative. And that's good news, especially when you look backwards and remember that we have been as high as 20 or 22% at other points in the pandemic. So that trend is definitely moving in the right place, or moving in the right direction, rather. Another thing that we look at is a 14-day rate of new cases per 100,000 people. So for Dougherty County, if you look back over the last 14 days, there have been 122 new cases diagnosed. And because the population of Dougherty is around 90,000, that calculates to 136 new cases per 100,000 people. And again, the trend is very important to look at. There were times when Dougherty County was 250 or 300 new cases per 100,000 people. So that trend is coming down. There were times in the last couple of months when there were some counties in southwest Georgia that had 1,000 new cases over a 14-day period per 100,000 people. Most counties in southwest Georgia are now below 500. In fact, most are around 250 or below. And so Dougherty County has been enjoying a nice trend in that regard. It is important that we have testing readily available in the community, and it is. Many people are able to get tested at their primary care provider's office, the hospital test, and public health is still offering free tests for COVID-19. And so we want to urge people especially those who are symptomatic, to get tested. If you have been exposed to COVID-19, it's a very good idea for you to get tested as well. And it's easy to do. People can pre-register for an appointment to get tested, and that's very helpful to us. If we know how many people we're going to test on a given day, then we know how many staff members we'll need, and we know how many test kits we're going to need. And it also means that if everyone pre-registers, the line is going to move very quickly. When people don't pre-register, we have to gather a certain amount of data on the spot, and it takes a little while. So if several people are not pre-registered, it can really cause others to have to wait a considerable amount of time. So it's easy to pre-register. One way is to go online. You can do this 24 hours a day, and the address is covid19.dph.ga.gov, covid19.dph.ga.gov. 24 hours a day. You can see the locations that are available in Southwest Georgia, including Dougherty County, and you can see the times. You can select the location and the time that works best for you. Another easy way to do it is simply make a phone call. The number to call is 229-352-6567. We have operators there Monday through Friday and then on Saturday mornings. So those are two quick and easy ways to schedule your own test. There are several reasons why we want you to get tested. One is it helps us in public health to know how many folks we have positive in the community. It helps us to determine who needs to isolate at home, and it helps us to determine who has been exposed so we can instruct those folks to quarantine. So those are the main reasons to get tested. And throughout the pandemic, it's going to be important that we continue to do that. But I want to offer another reason why you might want to get tested if you're symptomatic. If you have had COVID-19 virus, and if you've had the symptoms, and if you've had a positive test, what that means for you is over the next 90 days, you will not be subject to quarantining again during that 90-day period. And I think Chairman Cohilas mentioned something earlier about the CDC's position on this, and that's where this guidance comes from. If you have had the positive test and if you have been sick with COVID for 90 days, if you're re-exposed, you do not have to quarantine. Furthermore, during that 90-day period, it's essentially unnecessary for you to be tested again. So that's one added benefit, and we have experienced several cases in the community like that where people had survived COVID and called us to see if they needed to quarantine because of an exposure, and we were able to tell them no, during that 90-day period it's not necessary. Today it's also, we've heard it mentioned that it's important to get a flu shot. It's always important to get a flu vaccination every year, but it's especially important this year, and I want to discuss a couple of the reasons why. I want you to consider what it would be like to have influenza and be very sick with that, and then when you get over that, you have a case of the COVID. And then I want you to consider what it would be like to have both infections at one time. And there is no law of nature that says you cannot have both infections. Both influenza and COVID-19 can be deadly. And it's just common sense that if you have both of those infections at the same time, your risk of dying is multiplied. So for your own health, we want you to get a flu shot and to get it as soon as you can. And then another reason is because we are hopefully anticipating the availability of a COVID-19 vaccine, and perhaps it will come this fall. And it's going to take a lot of our time throughout the medical community to distribute and administer the COVID-19 vaccine when it does arrive. And it appears that it's going to be a two-step procedure. So you'll have to have two of the COVID-19 shots. It's going to be quite an undertaking. We do not want and we do not need to be dealing with influenza vaccination at the same time that we're dealing with COVID-19 vaccination. It's going to consume all of our resources if we're doing that. So for the good of yourself and the good of the community, if you will go ahead and get that influenza vaccine during the month of September or October, then that will free up our resources in the event that we have the COVID-19 vaccine available in November. Influenza vaccines are going to be available through public health departments starting next week. You do not have to have an appointment. It may be a good idea to call ahead just to make sure that it's okay to come and get the injection, because the health department could be tied up with other events, perhaps related to COVID. But you can go to the health department starting next week and get your influenza vaccination. People 6 months of age and older should have the vaccination unless they've had a severe reaction in the past. We would love for you to have your influenza vaccine at the health department, but it does not matter where you have it. You can have it at the hospital, at a drugstore, at your provider's office. The main thing is just to get that influenza vaccine and get it quick this year. I want to leave as I remind you that we are still in the midst of a COVID-19 pandemic. People are getting sick and people are still dying from COVID-19. We want you to do your part. We want you to wash your hands, stay 6 feet apart from other people whenever possible. We want you to wear a mask or a facial covering. And by all means, if you're sick, please stay home.
Thank you, Dr. Ruiz, for your comments. We will now hear updates from Dougherty County Coroner, Mr. Michael Fowler.
Good morning. My heart is heavy this morning. Realize that we have been struck with a disaster here in Dougherty County, but as Mr. Steiner have mentioned earlier about the 9/11, many of you probably remember the day that it happened. You know exactly where you was at. I know I got called that morning when it happened, and I was deployed to New York, and I had to go up there and work really a total of 2.5 months at Ground Zero. Many lives were lost. And I don't want to forget those individuals. And all through this day, I would be mentioning about 9/11 because lives was taken. Years from now, the same thing we would be mentioning about COVID-19, lives that was taken. But this disaster here in COVID-19, I think, can be prevented by doing and practicing the order that the Department of Public Health and different ones have put out by wearing masks. And I want to encourage everyone. Different ones call my office, ask me about the mask. I think you definitely need to wear a mask. When I'm out in the public, I definitely wear a mask. But I don't ever want to forget the lives that were lost in 9/11. So keep those families still in prayer. When you think about the law enforcement, the EMS, the ones that tried to save lives, many lives were lost, and many of them still affected today. Many of them have diseases from this smoke and this soot that they went in and trying to save individuals. Same thing here in Dougherty County. EMS, the law enforcement, different ones try to go in and save lives. Department of Public Health trying to educate you what to do. So that's a life can be prevented if you just follow the orders. If I had a quote this morning, I would say, "In all thy ways acknowledge him, and he would direct your paths." I pray that God direct our paths as leaders here in Dougherty County, in Albany and Dougherty County, and helping prevent this virus from spreading any further. I want to say to God, I give the glory, because as the stacks have already been saying that the trend is going down. We're going in the right direction, but we can't lighten up. Sometimes individuals feel, well, people are not down like they was, they're not testing positive like they was, So now I'm gonna take a chance and getting out and getting in the crowd without my mask. I want to encourage you still wear your mask. Be safe. At this present time, we have 180 deaths here in Dougherty County residents that have died here. We have only had 2 deaths since the last press conference we had. And I want to say that the month of September, we have not had no death in Dougherty County residents here in Dougherty County that died from the virus. And that's why I say I have to give God the glory, because I pray that God give the leadership in leading you, and anyone that comes to this mic to give words of life to educate you what to do and what not to do, because that's a life that we can prevent from dying. So pay attention to what's going on. You shouldn't have to be made to wear a mask. You shouldn't be made to wash your hand, be made to practice social distance. This should come natural. So I want to encourage you to mask up. Like I said, we have not had a death in September. I don't want to see another death in September or for the rest of the year from this virus that we can prevent, and the things that we can do to prevent from happening. You can't prevent a heart attack or cardiac arrest or some things that happen in life, cancer, but this virus is something you can do to prevent it. Again, so let's keep the ones in the chief already, we had a moment of silence for the ones that life been lost here in Dougherty County. But think about it, could have been you, could have been your loved one. So let's keep them in prayer, and also the ones that was at 9/11. Thank you.
Thank you, Mr. Carter, for your remarks today. We'll pause now for any questions that anyone may have today. In being that I am a fire chief, I'm certainly affected by this day. You will notice flags across the city, across this country, that are lowered to half staff today. I will never forget where I was that day. It's an honor to serve this community, be your fire chief and emergency management director, and I'll just end today by saying, shall we never forget. That ends our press conference today. Thank you.